My early starts to my medical career was a bedside nurse in the medical ICU. So I did have a lot of exposure to the more critical pulmonary patients there, and as the pandemic started, there was my exposure to coronavirus and more of the severe illness again. So when I finished my training as a nurse practitioner, it made sense for me to transition into the role of an outpatient long COVID provider, plus some general pulmonary, just given my experience at the bedside. We try to have a really in-depth conversation with our patients. Our initial intake is 60 minutes, and that's kind of a minimum. So we spend a lot of time trying to get a good foundation built with the patient, a good history of their symptoms, and spend a lot of time educating them on what we as the clinician also know and have seen with our long COVID trends, and get them some resources and discuss with them a good plan to reduce their symptom burden and to aid in their long-term recovery. I explain it to the patients as if we're triaging your symptoms. We're trying to get that good foundation built and give you a little bit of a roadmap as far as here's where we think you'd benefit from continued assessment and long-term involvement. Our goal to reduce patient symptom burden is to try to draw parallels between the long COVID presentation and what we already know has established treatment pathways in medicine. So if someone presents to me like they are having some post-viral, post-COVID asthma, I'm going to get them in touch with a pulmonologist. If they're having gastric upset and symptoms like irritable bowel, we're going to get them GI support, and etc. It's very front heavy with our visits, and it's a lot of satisfaction as a provider having a patient come to me and say, you've listened to me, you've taken the time. So we try to get updates at set intervals, and so to be able to see some progress over that amount of time, it helps us know that we are doing something right and we are helping patients achieve a better quality of life, better functional status, whatever those goals might be for them. It stems back to my time as a bedside nurse. Unfortunately, since it was during the peak of the COVID pandemic, a lot of my patients didn't go home. And so now I am able to help patients who still have their families in their homes, and I can make some subjective and objective improvements in their goals for themselves and help them get their lives back. So just seeing them acknowledge progress and be happy with that progress is really why I do this.